What are the best shoe features for a diabetic foot, and what shoes do we find these in? So the features for a diabetic foot, so the mechanical features are the usual features we look for in any sort of running shoe. So I'll just run through those quickly, and it's where does the shoe bend? So it should only bend through where your big toe bends. It shouldn't twist too much. It should have a nice high firm heel counter to help to hold the foot straight, and it should be able to be fastened to the foot. So they're the regular features we look for in a running shoe. But when we're trying to select a shoe for a diabetic foot, there's a few other features that we look for. So this is the InStride men's Aerostride shoe. You can find these at ergonx.com.au. And so the features of this shoe that make it great for a diabetic foot is that it's blind seam. So if we look inside, it's a little bit difficult to see in the camera, but all of the seams are blind seams. So there's no threads that stick out and nothing to irritate the foot. This Aerostride men's has this forefoot neoprene section. So if you look here, this whole section is neoprene. So if you have any relatives with retracted toes that stick up or claw up, they'll actually sit up through the front like this, and they won't irritate the tops of the toes. So this helps to prevent ulceration and corns and just irritation on the toe, and that helps to limit infection. So one of the biggest problems that diabetics have is that if they get infected, they don't heal well and they don't feel very well, so they're at greater risk of amputation. So anything we can do to reduce infection or damage to the foot is a really great feature in the shoe. So blind seams and this neoprene foot section helps to limit the amount of irritation on the toes. So you can imagine if they've got retracted toes, anything we can do to increase the depth in the shoe will help as well. That's why we like this Aerostride men's, because it's got these removable liners. So we've got your regular liner, and then we've got these other two liners that if you have a look, this one's 4 millimeters thick, and then we've got this third one, which is another 4 millimeters thick. And what that does, if we take all of these out, it means we've got another 8 millimeters of depth in the front of the shoe, or we can adjust it to comfort. So we can adjust it to fit the depth of the patient's foot in the forefoot section here. So if they've got very retracted toes, we can reduce that down so they don't push on the top of the shoe. The other thing this is great for is if we're making a custom-made orthotic to help to control the pronation or supination of or even just deflect pressure off any bony prominences on a patient's foot. What it helps us to do is we can actually remove a depth adjustment, so we can go deeper in the custom-made orthotic, or we remove both of them. So we can go deeper in the custom-made orthotic and have more cushioning where we need it, or we can have more support where we need it in the shoe. It's got a great outsole, so it's grippy but not too grippy. It's a nice rubber outsole, so it's non-slip, low static, and it's just a great shoe for a diabetic foot. So this one is called the InStride Aerostride men's, and you can get these at ergonx.com.au. I hope this helps out with you treating your patients, or if you've got diabetes yourself, or if you've got diabetic relatives, this is a great shoe to help to limit infection, limit irritation, and also support their feet and accommodate a custom-made insole. I hope this helps. Thanks. If you enjoyed this video, please like, comment, and subscribe. It's really simple to do, and it really does help out our channel. If you need more information on the topics discussed, you can find some links in the description where they'll take you to our website where we can discuss this in a little more detail. If you have a specific question that you'd like answered, please comment in the comment section below, and we'll do our best to make a video to address your question. Thank you all for watching, and we'll see you next time.